I'm Melissa.
And I'm Lee, and we are busy mums, company founders, and all-round early learning nerds. Welcome to our podcast, Growing Little Humans.
Kids aren't born with a user manual, so each week we'll try and cover many topics that you guys encounter and worry about each and every day while you're raising your little humans.
Dr Rajeev Tomar is a Senior Consultant of Pediatric and Clinical Director of Women and Children's Institute at King's College Hospital, London, Dubai. He is also the Director of the Pediatric Liver Transplant Program. Dr Rajeev trained at two of the world premier institutes, Great Ormond Street Hospital for Children and the King's College Hospital in London. His area of special interest is paediatric gastroenterology and hepatology.
Hi, Dr. Rajeev. Thank you so much for joining us.
Thank you very much for inviting me. It's nice to be here.
So I know that obesity, especially in adolescents, is on the increase. So today we were hoping to have a conversation with you about obesity in children and the trends moving forward. So can you tell us where are we at with child obesity, and is it looking like it's going to be a problem?
First of all, I should congratulate you for picking this topic because it's a very important topic to be discussed upon.
Yes.
I think obesity, as you rightly said, is a global phenomenon. If you look at the current stats for pediatrics especially, the trend is alarming. So although the obesity in adults have doubled, it's almost quadrupled in children.
Oh, wow.
So if you go by the numbers, then we can say it's around 37 million children who are below the age of 5 years are now obese or overweight. And if you include the entire pediatric age group, which is up to 16 years, it's mind-boggling. It's around 390 million of children who are overweight or obese. And coming especially to our region, I must say we are around 5.4 million.
Okay.
Which is around 2022 data, and you'll be alarmed. It was only 3.4 just a couple of decades ago. So it's an alarming trend. In a nutshell, it's a time bomb. It's a time bomb which is about to explode, yes.
And I had seen that in the Middle Eastern region, that it was a particularly fast-growing problem.
Yeah, we are labelled as the second highest region in the world with childhood obesity.
Yeah. And what are the primary causes for this childhood obesity?
So again, obesity is a very complex phenomenon. That's the reason everybody's struggling to tackle it. But yes, it's a complex combination of genetics and what we call as obesogenic environment, which means the amount of calories a child is taking in and how they're burning those calories. It's a fine balance between genetics and this obesogenic environment.
And I think too that part of the problem is nutritional education, because especially within this region, we've gone in the UAE, for instance, in the last 50 years, we've gone from nomadic tribes to people being more settled, and the introduction of Western fast food and those types of things, which has been a novelty, and the exposure to a lot of foods that were not eaten here before. So I think that education on nutrition is missing. That's
absolutely true. So in simple terms, obesity means you take more calories and you burn less.
Yes.
And of course, all these foods from which are junk food and which are high in calories, your carbonated, sugar-intense beverages are to be blamed. So yes, it's a fine balance, but you're absolutely right. It is on the increase because we're trying to copy and leaving out our traditional ways in this region.
And I was reading that we're not only just eating more high calorific foods, we're also eating more food than we used to.
That's correct.
So it's more accessible, so we're eating more of it. So
that's
obviously
correct.
That's got to have an impact as well, more processed food.
So
talking about that, so what are the short and the long-term effects of childhood obesity?
So as I said, obesity affects almost every part of your body. If you just want to discuss briefly about the immediate short-term effects of obesity in children, I think people do understand nowadays, because of awareness, the harmful effects on your what we call as cardiovascular, your heart system, where you tend to have high cholesterol and even high blood pressure within the pediatric age group, which used to happen in later in the life, but that's happening in pediatric age group. you do start having kids who are obese having a very abnormal metabolism for your sugar. So you do have what we call as early onset diabetes,
Right,
which used to
yes.
be a phenomenon seen later in life. Obese children are now very prone for what we call as a non-alcoholic fatty liver, and you'll be shocked to know that the most common indication for liver transplant in older adults, young adults, is actually your fatty liver disease, which starts in pediatric age group. These kids are also very prone for getting gallstones. They're heavier, so your joints do have the burden, so they have joint pains.
Yeah.
And again, not to forget, which people do tend to ignore, is the mental effect it has on these.
That's
in
very
these kids.
true, Dr. Rajeev. It's not just the physical problems with the body. It's actually very much the mental
Yes,
wellness of the children as well.
correct. That's very commonly ignored. Yeah,
Absolutely. As a teacher, we can see that a lot of the time children are having trouble focusing and they're having trouble concentrating. A lot of that's to do with what they're eating. It's not having the impact that it should be having for them to be able to concentrate for
correct.
long periods of time, and being able to be out on the playground more time than they're sitting in at a desk.
Absolutely right.
So
Yeah.
that's got to have some impact as well. So what are some other short-term effects? I just said concentration and lack of focus.
Yeah,
What is-
so if you come in more of the psychological aspect, as I said, it's very commonly ignored. People are not very comfortable discussing about it. Even the parents in our clinic are not very comfortable discussing about it. It's only when we try to dig in deeper, we understand, yes, these are the children who are lacking they do have this low self-esteem.
Yeah,
They-
lacking self-confidence.
They do, and
Yeah.
they are scared of what you call as, social situations. They don't
Yes.
have that confidence. They
Yeah.
lack that. A very interesting phenomenon is coming up, what we call as, emotional eating,
Yes.
which is a way of them coping the stress and the anxiety and the stress. They
Yeah.
start eating more. And when they eat more, they do understand they're gaining more weight. Then they start feeling guilty. They are ashamed of self. So the whole cycle goes in the wrong direction.
Yeah, the long-term mental impacts
Yes.
can be enormous.
Yes. And even we rarely do see some kids in this age group having this what we call as body dysmorphism. So
Yeah.
they're obsessed and they're preoccupied that they look abnormal in body shape to
Yes.
the point. If you have some signals that they don't go in front of the mirrors, they're ashamed to see their body. They're just completely misunderstanding the whole body shape. They don't wear tight clothing, so they start wearing those baggy, loose things.
Yes.
And they suddenly start avoiding any sports activities which are
Yes.
Yeah.
exposing,
Which is
like
a
swimming.
vicious cycle,
It's
isn't
It's a
it?
vicious cycle. So these are your clues, and these are warning signs, because these are important points not to be ignored.
Yeah, and I think when you're talking about them looking abnormal when they're getting on social media, and
Yes.
as we know,
Yes.
little ones have so much more access to that, then they're seeing that whoever theirs on social media is looking different to how they look. And
Yes.
then, like Lee said, that's another vicious cycle of I don't look that way. And
Yeah. Not to forget, bullying doesn't only happen in schools; it happens online too.
it does.
So
It does.
this is something
Yeah.
which is also worrying.
Yeah, it doesn't help.
But
the
there's
situation.
definitely, I'm seeing a much greater awareness in the community these days, and I know that the governments are definitely looking at what measures can they put into place within the community. Fitness incentives and initiatives. There's a lot more get fit kind of activities that they're trying to encourage. I know that they're trying to promote activity in schools, like by having jiu-jitsu teaching within schools, and and different camps and things. Are you seeing a lot more prevalence of that now in the community?
Oh yes, that's fine. Dubai Fitness Challenge starting
Yeah.
tomorrow is a perfect example. So yes, we do see that, and that's very encouraging to aware that the public is not talking about. I think if you see, it's not that bad all across the globe. There are a few countries who are trying to reverse this trend, and these are the countries where we can learn our lessons from.
Leading the way.
Leading the way. So Japan, Singapore, a few in France and Belgium, they are pretty, and they are actually forcing what you rightly said is about the school, because this is where they spend most of their time.
Yes.
Yes.
We as doctors are also being encouraged to say we have like a baby-friendly hospital, because remember, the nutrition and the diet of the mother during pregnancy can influence how these
Right.
genetics these can modify. So, and breastfeeding is strongly recommended. So, as a baby-friendly initiative, we're encouraging that strong breastfeeding, not to encourage, formula feeding in early life. These
Yeah.
are very good initiatives which are on place, and hopefully we'll see the results.
Laying the foundation for future habits. But
Correct.
that's a really good point, though, that you're making, with mums and during pregnancy. But I think, too, parents have to lead the way with children and set a good example, essentially, don't they? And because obviously these things are a big problem in adulthood as well, obesity. Yes. So it's great if children grow up in an environment when they understand that physical activity is really important. Having a balanced diet nutritionally is really important. So it kind of starts in the home too, doesn't it?
It's no brainer. I totally agree. So that's a standard practice in my practice. So yes, normally in my practice, kids are referred with being overweight, which have abnormal liver enzymes, and they have been bombarded with a lot of information about losing weight X, Y, Z.
Yes.
And of course, they're not winning. And one of the primary factors is the family has never been involved. So when I do speak to them, I'm targeting the parents first rather than the child.
Yeah.
The moment I start talking about weight, which I don't, is I'm losing the confidence of the child because he's bombarded, his self-esteem is low,
Yeah.
he's been bullied because of the weight.
Yeah.
So the only time I do talk about weight is when I tell the patient, listen, I don't want you to lose weight. So that does raise their eyebrows. But I said, I don't want you to gain either, because these are growing kids who, if they keep on gaining height and they can keep their weight steady, their BMI is actually dropping.
So
yes, that is one interest, one comment which does interest the child. Listen,
Yes.
this is the first so-called medical professional telling me not to lose weight.
Yeah.
And that sets the ball rolling, and this is where the family gets involved. You have to be an example. So we do have a family meal time. This is very important. Family, activity time. This is something so important. You cannot blame a child for eating more calories because they don't themselves go out for shopping.
Yes.
Yeah,
Yes.
but they actually don't really understand
Exactly.
nutritionally which things on their plate are more
Correct.
calorie dense.
Yeah, so this is very important. And I do tell my parents, listen, rather than refilling your plate all the time, just bring what you want to eat at one portion and try to see whether you can swap something which is less calorie dense, and that seems to help. So yes, the family, they have to lead by example. Yes.
Yeah. I always read about the plate for children, which is half a plate. I might be wrong here. Correct me. Half a plate is your vegetables, and then you have a quarter of your plate being protein, or a quarter of your plate being
Correct. Yes.
carbohydrates. But I think it's all about balance, really, isn't it? And,
Exactly.
A
balanced diet, good side portion, not too much sugar in it. That's your mantra for
balance.
this.
Yeah, balance. Having the
And so,
balance.
Dr. Rajeev, if we have any parents out there that are concerned about their child's health or nutrition from a weight perspective, who would you suggest that they see to address that?
See, we as in our hospital, and I think that's what the standard practice should be all across the globe, is we work as a multidisciplinary team. So we do have myself leading for the obesity program along with my endocrinologist. So they do because we have a very important role played by the dietitian. And as I said, if we do have collaboration from the school, we do tend to work with the school.
Excellent.
So this is something which we say we work as a team.
I know King's College Hospital London Dubai has an amazing team, so
Yes.
it's definitely a very good start for parents to explore.
Yes.
But it's been so lovely to chat with you today, and I think this is a topic that cannot be over addressed because it's just of so much significance. The stress on our hospital system, if we let this problem grow, is going to be enormous. So it's definitely something that we need to be addressing in young children.
Surely, spot on.
Fantastic.
And here come the legals. Our podcast is purely brought to you for educational and entertainment purposes. We are just two hectic mums, and we are certainly not licensed therapists.
This podcast is not intended as a substitute for the advice of licensed or qualified professionals. And if you do need some help, please seek out some professional advice.